So I'm Trilok. I work at the University of Michigan, and I also work at the Arbor VA. Been working in this teledermatology situation for the last 12 years, and been seeing things which has evolved since pre-pandemic, during pandemic, and right now post-pandemic. These are my disclosures, and do you guys know what this date means, or the month means? The WHO declared it's the end of the pandemic, right? Pretty much all of the countries declared that there is no pandemic anymore. Have you even thought how many dermatologists went back doing face-to-face? I understand that, we say that the teledermatology is integrated in everything, but I'll tell you, on the ground, there is a reversal of telemedicine back into the boonies where it had not started. So that actually gave us the impetus to do this study, which was when I was a part of the task force to look at what are the dermatologists' perception post-pandemic. Will it sustain? So to do this, we surveyed our AAD members. A total of 5,000 participants were selected from the 12,000 group of people. And out of that, 591 dermatologists responded to it. So a response rate of 13.5%, which is actually, I was told, is great. I was like, that is abysmal, but that's what it is. So during the pandemic, we all knew, right? Like, previous to the pandemic, it was just 14% of the teledermatologists used, and at the end, since COVID, it's 96%, but we don't have a data post-COVID to show how many of these teledermatology adoption has gone down. Some actually argue those are kind of hopefuls forever, that it has been integrated into telemedicine, into the practice of dermatology. That's one of me, but a lot of people are not. To be honest with you, they're not getting there. So we try to see what are the situations where we could help them adapt to it. So they still have issues with technology. This is the United States I'm talking about. I'm not even talking about the rest of the world, right? Where we think that the birthplace of technology is the United States, right? So 40% still think that there is technology and connectivity issues is the one of the important things. And of course, Peter rightly pointed out, everything boils down to reimbursement and the greed. Unless you get paid for what you do, it's kind of really hard for anybody to motivate anyone. And we can see that in the crowd. We are just hardened followers of telemedicine. Concerns regarding malpractice and liability, because there have been laws which have been going to be reverted in the United States, and I don't know how many of the private payers are going to still pay for this, how many of the state laws which were all taken away is going to still be there for the sustained growth which was seen during the pandemic days, during the post-pandemic time, and the government regulations. So good news is it's till the end of December of 2024, we'll have all the things which have been laid out by the Medicare, which is the government system of taking care of telemedicine. They're going to be keeping the regulations the same. And though I think I'm going to ask the current chair to resend this survey and ask him how many of them will still respond the same way? Because we sent it during the pandemic, and everybody were like, we have to adapt to teledermatology, but they have seen what happens to telemedicine. So 85.2 felt it would be there, but, and also the other thing is, like, I think Veronica in the crowd will agree that the store and forward, which is probably the best way of taking care of dermatology consults, is not reimbursed well. So I don't know how much there's going to be sustainment of this kind of program. And then we also try to look and ask the members, where do you think teledermatology would be used the most, and what conditions we should be using that? And for example, nobody wanted to do total body skin exam, and I completely agree with that. It's impossible. Imagine sitting on a roller coaster because the patient is going to move the camera left, right, central, everywhere, and it's going to be like, well, what am I looking at? Even the best cameras don't give you the best clear images when you use it. And then I think the still images are still the way to do it. So the way we would say is like acne, rash are the ones which work best. And if you have a dermatoscope, lesions, add the lesions into that. And I think those are three things which would be suited best for teledermatology. And we recently published a study to do that too. So kind of extrapolating all of that to what we want to do in the rest of the world, right? So only 58% said they intend to continue to use it after the pandemic is over. What has happened in the rest of the world? We really don't know. Like how many even took it up and how many have reverted back. Are the perspectives the same? Like reimbursement might not be the biggest issue. Government loss might not be the biggest issue. So this needs to be studied to kind of extrapolate this data into the rest of the world. And as I said, like when I was looking at slides from the WHO and from the Passion Project, are a new or follow-up acne versus skin checks, are they even a concern? Or do they even matter when you don't have dermatologists? So these things can be done maybe like once we make the new committee of the International Society for Teledermatology, that we might send out surveys to see what countries and what are their concerns, what are their barriers. As I said, these barriers are limited to the United States and their population, so this could be kind of used to learn from what other countries have, what other situations. Like, I don't think reimbursement, as I said, and the technology would be a barrier in a place where there is no technology at all. So these are the things which we should be looking at, and kind of building decision trees when you want to do teledermatology. Like for example, you should not be doing, as I said, total body skin evaluation, bleeding more, changing new lesion, diffuse blistering rash of the skin, where these patients would come in for an in-person, whereas the other things we can actually interchange with if it's new or a follow-up. There are situations where you can use teledermatology first, which would be acne, which is like probably the lowest, and there are enough studies to show that too. Eczema and psoriasis follow-up, like if somebody's on Dupixent, they don't have to come and sit in your office and say, my skin is clear. And even with psoriasis, with all the biologics and the new TYK2 inhibitor, they don't need to be in the office. So what does it do? It actually frees up to see more patients. So I think that's where I'm going towards. And then finally, as I said, this was a part of the study, and we saw that there are still perceptions, and I was hopeful when it said 60% would still practice teledermatology post-pandemic. I think the next subsequent survey will determine how many are still doing teledermatology. I think that's pretty much it. Thank you.